Chronic myeloid leukemia is a cancer of the bone marrow, and without treatment that is usually fatal. In the 1990s we were able to control the disease, but inevitably it would progress to a fatal end stage. In the 2000s we were able to control the disease to the point where people could get on with relatively normal lives but still had the toxicity of the drugs that we needed to control the disease. And the focus today is to see if we can get such good control that we can actually get them off therapy altogether. In the last 12 months we've developed a clinical trial, which is the world first, where we're using a new agent that was developed by Novartis that we've been working on closely with them over the last 5 years. Now we're able to be the first trial centre in the world to use this drug for patients when they first present with chronic myeloid leukemia, and we're very excited with the results we're seeing so far. Fortunately, funding doesn't equal results. With very targeted funding and the right group of people, we can make a meaningful impact worldwide. There are groups around the world who have massive funding, but if you don't ask the right questions and have the right people in the room, you don't necessarily get the most efficient use of that funding. I think one of the real keys to success in medical research is to build an appropriate team where you have the clinician perspective on what matters in this disease, but you also have the scientists who have the necessary skills that can actually answer those questions. I think that's been a really strong feature of our work. Each patient is a piece in the jigsaw puzzle, and their willingness to be part of our trials, to give us their blood, their bone marrow, to study, it's quite amazing. I've never had a patient refuse consent, which I think is quite remarkable over several decades and several hundred CML patients. I've seen them grow up and grow older, and so they've come on this journey with us, and I think that's a really important part, that they see the progress that we're making and that we see that their lives are impacted by that.